me talk about review for many of you, pharmacology. Okay, let me talk about pharmacology, basic pharmacology. So you remember pharmacokinetics versus pharmacodynamics? What's the difference between pharmacokinetics, I did this, and pharmacodynamics?
Oh, yeah.
You remember? Danielle, do you remember pharmacokinetics versus pharmacodynamics?
Yeah. I
Okay.
think,
Can you say the difference?
yeah. So I think if I remember correctly, pharmacokinetics is ADME,
Okay, he said admin. Let's put this here.
which is absorption, which was absorption, distribution, metabolism, and excretion.
Okay, so what's pharmacokinetics then?
How the drug interacts with the body, or
Okay, so remember this. Pharmacodynamics, letter D. What the drug does to the body. What the drug does to the body. Example, an antihypertensive. What will that drug do to the body? Lower the blood pressure. You follow? An anti-hyperlipidemic. What will that drug do to the body? Lower the cholesterol levels. That's pharmacodynamics. Dynamics, what the drug does to the body. Can you follow? Pharmacokinetics, what the body does to the drug. What will the body do after you take a Tylenol? What will your body do after you take an ibuprofen? Okay. And Daniel said pharmacokinetics, which is good. To remember pharmacokinetics, you say admin. And what's admin? Absorption, distribution, metabolism, and excretion. Let's check. Will your body, because the other one is dynamics, what the drug does to the body. Okay. Pharmacokinetics is what the body does to the drug. Will your body absorb the drug?
yes.
Yes. Will your body distribute the drug?
Yeah.
Yes. Will your body metabolize the drug? Yes. Will the body excrete your drug? Yes. Okay. So it's good that Daniel remembered that pharmacokinetics, an easy way to remember for pharmacokinetics is admin. The body absorbs the drug, the body distributes the drug, the body metabolizes the drug, and the body excretes the drug. Can you follow? Okay, so I want to talk about pharmacokinetics because that's the basic, pharmacokinetics and pharmacodynamics. That's the basics, one of the basics of pharmacology. Now, this ADME pertains to each system or organ in the body. If a drug is taken by mouth, we call them PO drugs, per orem, by mouth, okay? Absorption happens where? Do you remember, Tyra?
In the liver.
No.
The small intestine.
Don't change it. Okay, so the absorption happens for oral drugs. I'm talking oral drugs that you take by mouth, okay? The tablets, the capsule. The absorption happens in the small intestines. Distribution happens in we call it the circulatory system or the bloodstream. Can you follow? Metabolism happens where, Justine?
In the liver.
In the liver. And then excretion happens where, Freddie?
Goes to the liver, then it goes.
Where? Where do you excrete? What's the organ responsible for excretion?
The rectum?
Oh, no.
Oh, wait. The back? No.
The final toxic product But where does the filtration, the excretion happens? I'm gonna tell Mr. Jackson to take away your anatomy grade.
The bladder.
What? Can somebody help a friend?
The
Kid-
kidneys?
Oh, wait,
Daniel was doing this. Yes, kidney is very good. So, pharmacokinetics admin, remember this. If a drug is taken by mouth, the absorption happens in the small intestines, the distribution happens in the bloodstream, the metabolism happens in the liver, and the excretion happens in the kidneys. The reason I wanted to start this is because we're on the renal system today, the excretory system or the urinary system. So we're going to talk about the kidneys. But here's another information I want you to know. If a drug passes the liver for metabolism, we call it first pass metabolism or first pass effect. Okay? This metabolism gets bypassed if the drug didn't pass the liver. So we call it no first pass. Can you follow? No first pass. If it didn't pass the liver for metabolism. And what dosage forms are this? If the drug is IV, it didn't pass the liver. Directly into the veins to the bloodstream. No metabolism by the liver. We call that no first pass. No first pass metabolism, no first pass effect. Another one, sublingual tablets. You put the tablet under your tongue. There's a lot of veins under your tongue. The drug gets absorbed 100% right away under your tongue. Can you follow? No liver metabolism, no first pass effect. This information I'm talking about is important not only for final exam, but for the PTCE. Okay? You guys know, I mean, not the freshmen. I forgot to tell them when we're in the campus tomorrow, we're going to give you 2 cents worth to the freshmen. I like it better when you're face-to-face. Okay? You should have at least how many notebooks, Daniel? 1, 2, 1 for Miss L's lectures, pharmacology, 1 for math. Justin, did you say 4? You keep 4 notebooks?
I have 3.
You have 3, Daniel. And how do you assign those 3 notebooks?
Wait, I have 4 actually. They're color coded.
Okay, so notebooks are binders that are color coded. So what are the 4 notebooks that you have?
Actually, I can get them for you right now.
No, it's okay. Just tell me the legend. Like, what are they
Um,
for?
Okay, so one of them is for the pharmacy math, one of them is for the pharmacology, and one's for the drug words and drug word abbreviations, and the final one is for this is for PTCE purposes.
Yes. Why do you have a separate PTCE notebook?
That was just so I can review and stuff like that, practice, because you talk a lot. You mention lots of things that are in the PTC, so I've been over time collecting the information so I could.
Good. Yeah. So that's a good way. 4 notebooks. Why? Because I like saying hint, hint, wink, wink. Not only for the final exam, but the board exam. That's why we have 100% pass rate on the board exam. I even took the test for you, both PTCE and ExCPT. And then how many students have I had? In the last 14 years, I had over 8,000 students online and in campus. In campus in Vegas, probably about 1,000. Okay, and they come back and tell me what's in their test. So I remember those and I put them together and then I tell you the tips. This is why it's so harder it's more difficult for you to fail because you have all this information from previous students. Okay, Justine, do you have the same 4 notebooks?
Yeah, but I do it on my laptop. The only one that I have physically is the drug words and math.
Okay, very good. So she does it digitally. I have students just like Justine back in the day who does it digitally, like using notes or whatever app you like. 1 notebook, 1 digital notebook, 1 class. And I think having it as pharmacology and then math is a separate notebook and then your drug words is a separate notebook or a general knowledge like tech duties, compounding, pharmacy law, that's a separate notebook. And then your PTCE tips should be separate. Because I say a lot of those on a minimum, probably 10 a day. I say 10 tips for the PTCE or questions a day. Every time you see me, I'll say, okay, this shows up, this usually shows up on the PTCE. The PTCE freshman, just so you know, is Pharmacy Technician Certification Exam. And that's the national certification exam that pharmacy technicians take. Okay, we're going to talk more about that. But for now, because we're only 2 hours, I'm going to focus on our lesson plan. So going back, metabolism happens in the liver, but not all drugs have to be metabolized by the liver. So when it passes the liver, it's called first pass effect. When it doesn't pass the liver, it's called no first pass. And I gave you examples of drugs that do not pass the liver. The injectables do not pass the liver. Sublingual, which is under the tongue, do not pass the liver. We have what we call buccal, okay, or others call it buccal. B-U-C-C-A-L. Buccal or buccal drugs are drugs or tablets that you put between your cheek and your gum, and it dissolves there. Okay, why do they do that? Absorption is faster because your gums have more veins, your cheeks have more veins. Okay, this is another one that has no first pass effect. Take note, I mentioned two right now, just right now. Okay, first pass effect shows up on the PTCE, the terminology, first pass effect, first pass metabolism. Buccal drug or buccal drug shows up on the PTCE. And it usually is asked us, what is the drug? What is the dosage form of a drug wherein it dissolves between the cheek and the gum? And the answer is buccal. Buccal tablets, okay? So just that, 30-second alone, I mentioned two. So I wanted to discuss this particular topic, admin, pharmacokinetics, is because we're going to keep referring to it as we move on in all of our pharmacology classes, okay? For now, we're going to focus on renal or the urinary system. What is the major organ in the urinary system?
Kidneys.
Kidneys, very good. So, I'll show you. Can you see okay? You guys have this PowerPoint, just so you know, huh? So every time you meet me, maybe today you're scrambling. The next time you're going to be more prepared. Why? You can print this out in a handout format. And then as I'm lecturing, then you can take notes. This is how our kidneys look like. We have 2 kidneys. Okay? Studies showed that a person can still live with only 1/4 of a kidney left. Not 1/4 each, huh? 1/4. Okay? Just 1/4. So 1 kidney is gone and 3/4 of the other kidney is gone. But do you think that person is going to live a normal life, like an active life? 99% no. Because people with only 1 kidney left, they're always tired. They cannot do certain things. They cannot lift certain weight. Can you follow? So yeah, they'll live, but not a healthy one. Okay, but not a healthy life. So just a fun fact, I read that a long time ago, like it is possible for a person to still live and survive at 1/4 of a kidney. So know that we have 2 kidneys. Okay, how many ureters do we have?
2.
2. Okay, how many urinary bladders do we have?
1.
1. How many urethras do we have?
1.
1.
Okay. Another thing I'd like you to remember, I mean, maybe you have discussed this in Mr. Jackson's class. Sympathetic versus parasympathetic response. You did this in Mr. Jackson's class? Sympathetic is your fight. What is your sympathetic? How do we call that? Fight and?
Fight or flight.
Very good. Fight or flight response. But I say fight, fright, and flight. Fight, fright. I added the word fright, like you're scared. Fight, fright, or flight. Parasympathetic is rest and digest. So if you are to think about drugs that are affecting the parasympathetic responses or sympathetic responses, those are good codes. What happens when your in a fight. Like, think about boxers. What happens when you're scared? What happens when you're up in the air or paragliding or you're in an airplane? Okay, so those are your fight, fright, and flight responses, and those are your sympathetic system. Okay. And then your parasympathetic is what happens after you eat, rest, and digest. What happens if you're so relaxed? Okay, so this is what's going to happen. And I'm going to tell you. This usually shows up on the PTCE. What do you think happens to your pupils in the sympathetic response? Dilate or constrict? Pupils. So sympathetic, you're frightened, you're scared, okay? You're in a fight, or you're up in the air. What do you think happens to your pupils in the sympathetic response?
Dilate.
Dilated. This shows up on the PTCE. In the parasympathetic response, it's constricted or relaxed. Can you follow? Okay. What do you think happens to your blood pressure in the parasympathetic?
Is it?
Raises.
I said parasympathetic.
Lowers.
Lowers, because you're relaxed, right? What about sympathetic?
Raises.
Raises. You're boxing with somebody. Of course, your blood pressure is high, right? That's your sympathetic. Okay. Blood pressure is high in sympathetic, low on parasympathetic. By the way, another term for parasympathetic is cholinergic. Okay. Sympathetic and cholinergic. And then your sympathetic is called adrenergic. Sympathetic equals adrenergic. Parasympathetic equals cholinergic. You follow? I'll type it in the chat box so you can take notes of it. Sympathetic is also called adrenergic. And then your parasympathetic is also called cholinergic. Those are the basics of pharmacology because I'm going to keep referring to this. So let's go back. Now, so your pupils, what do you think happens during sympathetic response on the urination part? When you're boxing, think about the boxers. Do they pee while they're boxing? So you're sympathetic. Can you imagine like this boxers Floyd Mayweather, their pants are wet because they couldn't control their pee? So in a sympathetic response, it's stop urination. Can you follow? In a parasympathetic response, when you're more relaxed, that's when you feel the urination coming, right? So that's how you want to think. Okay, next one. Let's talk about poop. When do you poop, right? So don't tell me after a coffee or when I wake up. Okay, let's go back to sympathetic and parasympathetic, okay? Coffee stimulates defecation for many, okay? Stimulates defecation, not just urination. Coffee is a natural diuretic, so it stimulates urination. But for some, it also stimulates defecation, okay? Or for many. Let's talk about defecation. So, you think you poop while you're boxing? Just even in the plane, you don't even want to get up from your seat because you're going to have to ask whoever's next to you to get up if you're not in the aisle seat, right? So you prevent yourself from using the restroom. So in sympathetic, no defecation. In parasympathetic, when you're relaxed, after you eat, that's why it's called rest and digest. That's when you poop. Right? That's when you feel like pooping. I just ate a good meal. I'm so relaxed. Now I want to use the restroom. Yeah, especially if you had coffee after a good meal. Now you want to use the restroom. Okay, so I'm telling you this in more layman's terms so that you understand. Oh, sympathetic. Oh, parasympathetic. Okay, but easier way to remember: sympathetic, fight, fright, flight. What happens during a fight, when you're frightened, and when you're in an airplane or paragliding, right? We don't want to see people paragliding and just poop falling off the air. Because of this responses, normal responses, right? But as we get older, these things go away. Like that's why there's incontinence in older people. That's why we went from diaper when we were babies and then back to diaper when we get old. It's the circle of life, as I call it. Yeah. So there's diapers for babies and there's diapers for adults. Okay. And I'm going to talk about that because we lose control of our bladder. So this is our urinary bladder. It only holds a certain amount of liquid. Who knows the fun fact? How much liquid can the urinary bladder hold before you can say, I really, really, really need to go? Who knows that fun fact? I'll upload my lecture packet. I always give away lecture packet for pharmacology. It's a summary of your textbook, a summary of the information that you need for the particular class. And it's very, very useful. I've been using that for over 10 years. Very, very useful because you can just highlight those as part of your notes for the PTCE and the finals. Okay. I will grab my water. When I come back, I want to see answers in the chat box because I want to see what information you've seen on how much liquid or how much urine can your urinary bladder hold maximum. Okay. Of course, each person is different. If you're a bigger person, you might have a bigger bladder. Okay. So I'll be right back. I'll get my water. Be right back. I forgot to bring my water. Okay, so when I got out, my son's in the kitchen and he's having breakfast. And he was listening to my lecture and he said, Mom, you can also add freeze on the fight, fright, and flight, if that helps. And because he said, well, when you're frozen, like when you're frightened, you get frozen and then a lot of things stop. I said, oh, okay, interesting. So he said, add a freeze in the sympathetic response. My son's a geek, so he likes things like this. Anyway, 700 ml. Some of you found 500 ml. Some of you found 700 ml. So it looks like it's 500 to 700 ml. Okay, I like this. Hilda said 500 ml for women is what she found, 700 ml for men, which tells us normally men will have a bigger bladder, a bigger vessel to hold the urine. Okay, so interesting. So it's from 500 to 700 ml. Okay, when you because coffee is a natural diuretic. When you drink coffee, you have to go. Like last night, I had coffee with my friend I haven't seen for 25 years. And we both ordered Americano coffee, same size, but I had to pee like 4 times and she only had to pee once. Same size, same exact coffee. Okay. Who amongst you have to pee more than 2 times in a regular cup of coffee? More than 2 times. Who amongst you? No? Just once? So I really think I have a small bladder. Because no matter what, I just pee most of the time. Or, take note, which we will discuss. One of the signs of diabetes is frequent urination. Okay? So if you were not like that before as a person who should be listening to your body, you're not like that before, and then all of a sudden you pee a lot, it's called polyuria, Okay. Increase urination or a lot of urination, poly is a lot, you might want to get checked, especially if you have history of diabetes. Okay, because that's one of the signs. And I'm going to talk about that in a little bit. Because our kidneys are affected with diabetes. Okay. So here's how it looks like inside our body for a little bit. I wanted to show you a video how excretion works, but it's going to take up a lot of time. So once we're into campus, we're going to do all of those things like with extra videos. But here we're just going to go straight to the point. Okay, so this is how it looks like. The most important ones are you have 2 kidneys, and your kidneys are responsible for, what is your kidneys responsible for? Here, take note. Filtration, reabsorption, and secretion. You have 2 kidneys. Inside each kidney, there are arteries and veins. Okay? And we have what we call the medulla and the cortex. Okay? The medulla and the cortex. But it is very important for you to know what the function is of the kidney or the kidneys. Okay? Filtration, reabsorption, and excretion. And always refer to admit. Okay? We have 2 kidneys located in the back. Okay, in the middle back of below the ribs. So when there's pain at the back, when we have, my camera couldn't reach my back. Okay, when there's pain on the lower back part, one of the things the doctors think is it may be a kidney problem. Like lower back pain, okay? Not on the spine, but more on the, like at the middle of the hip of sorts, okay? So, because the kidneys are located there, okay? Your kidneys are about the size of your fist, so do this. So your kidneys are this size. Interesting, right? And then your heart as well is the size of one of your fists. You see that? That's why I said the bigger you are, the bigger your organs are. Okay? So this is this about the size of your kidneys. Okay? It holds about 2 quarts of blood. Okay? And what does it do? It filters. It filters the substances from the blood. What does it filter? It filters, just like any filtration system, it takes out the bad and the good. The usable and the non-usable, right? Or the reusable. Think about water filtration system. Okay? And then the usable, what do you think the usable, what do you think happens to the usable? It gets reabsorbed. And then brought it back to the blood for nutrients. Can you follow? And then what do you think happens to the non-usable or not so healthy or the body doesn't need for functioning? It gets secreted or excreted and released, especially if they're toxins. Can you follow? So these are the 3 major functions of your kidneys. To filter, okay, separate the bad from the good, reabsorb the good, secrete the bad. That's how I'll say it. Okay, so it's easier to remember. And then we have nephron. Okay, where is the nephron located? In the kidneys. Okay, millions of nephrons are contained in the kidneys combined. Okay, in the nephron we have the glomerulus and the tubules. Okay, going back to filtration. It filters, like I said, the bad, reabsorbs the good. What does it reabsorb? Electrolytes that our body needs for proper functioning. And what are these electrolytes? Remember this: potassium, sodium, and phosphorus. What usually shows up on the PTCE? Potassium and sodium. Because our heart needs it to pump. Our blood needs it. Okay, for proper circulation. Our muscles need it. That's why it has to be reabsorbed. Okay, next one. Here's our urinary bladder. It's so cute. It looks like an alien, or like if you put a helmet on it. Just my imagination. Anyway, so here's our urinary bladder. Attached to the urinary bladder are the ureters. So there's two. Okay, and then the urethral opening. Okay, and then this is where the urine comes out. Ureters, which is this yellow, you see, where's my mouse? Ureters, which is this, oops, the yellow ones, they move urine from the kidneys to the bladder. Okay, so they're connected to the kidneys. Okay, the urinary bladder is just a vessel to hold, collect the urine until it's ready for urination. And then the sphincter is the one that opens and closes for urine to come out. And then some people or women especially have the ability to hold their urine. Okay. Who do you think is more prone to urinary tract infection, male or female?
Female.
Female, because of the way our anatomy is. The female reproductive organ is open, more exposed. The male reproductive organ is closed, it's inside. Okay. Another thing, ladies, remember we wipe from front to back. That's one of the common causes of UTI. Okay. If you don't wipe from front to back. Okay. Who's more prone? Why are babies more prone to UTI? Why are babies more prone to urinary tract infection? Can you guess? Why are babies more prone to urinary tract infection? Babies usually have urinary tract infection.
They wear diapers.
Yes, they wear diapers and they don't get changed right away. So the urine is sitting in there, touching their organ, and bacteria likes urine. Okay, that's why. So it is very important that we change babies' diapers very often and not let them soak in it. Okay, quick check. We're done with the anatomy. We're done with the anatomy part. This is quick. Anyway, the kidneys are responsible for filtering blank products from the bloodstream.
Waste.
Waste.
What are the main functions of filtering of the bloodstream?
Filtration, reabsorption.
What letter?
C.
Hey,
It has to be secretion at the end. True or false? There's one ureter and two urethras.
false.
False. Why?
It's the other way around.
It's the other way around. Correct. There are two urethers and one urethra. Okay. Before I start on the, what do you call this? Before I start on the diseases or pathology of the excretory system or the kidneys, the diseases that affect the kidneys, I'll give you a 5. Okay. It's 11:03 a.m. on my computer clock. Let's come back at 11:08. You can turn off your cameras. I'll leave mine on. Okay. But I'll mute myself.